Welcome to Magnolia Medical Minutes, your local source for expert medical insight direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens of Super Talk Mississippi Media, and today's special guest is Dr. Jay Baker. Thanks for joining us today.
Pleasure to be here, man.
So today's topic is antibiotic stewardship. I keep hearing about antibiotic overuse. Why is this such a big deal now?
That's a really great question. And antibiotics are wonderful. They've saved tons of lives, but through the years, we've noticed that they've also created some issues too.
What does antibiotic stewardship mean? It sounds complicated.
It really does sound complicated, but at the end of the day, what we're trying to do with antibiotic stewardship is making sure patients are receiving the right medication for the right duration, and we're treating the right bacterium.
So if I'm sick, wouldn't it be better just to take an antibiotic anyways to be safe?
It makes sense to think that way. The problem with that is antibiotics only treat bacteria. So many of the reasons patients present to the hospital or to doctors may be from virus or the flu or allergen, things that antibiotics are not going to help with whatsoever.
So in this area, I've heard a lot about C. diff. Tell me, what exactly is that?
C. diff is one of our biggest issues, especially here in Mississippi. It's a bacterium that when antibiotics are used, the antibiotics kill the good bacteria and allow C. diff, the bad bacteria, to overgrow and become prevalent. We worry about that because it can lead to severe illness and it can even cause death. And that's why we want to make sure we have the right antibiotic for the right duration in the right patient. So here at Magnolia Regional, one of the things that we do, one of the many things that we do, is make sure patient access areas are clean, make sure those antibiotics are reviewed and we're using the right antibiotics for the right amount of time. We want to make sure that the patients and families have good information so that they take the medications as they're supposed to, don't stop early, and especially don't save them for the next infection that they may have.
So now, does this mean that doctors are hesitant to treat infection?
It may seem like that's the case, but that's not the case at all. What we're really wanting to do is make sure that we treat the patient appropriately with the right medication for the right reason for their symptoms and their illness. That's what we're really wanting to do. So if antibiotics are indicated, absolutely that is what the patient needs.
Thanks for your time today.
It's been a pleasure.
Be sure to join us again next time on Magnolia Medical Minutes for your local expert medical insight direct from the doctors at MRHC in Corinth.